Hello people, in this video let us look at this topic short stature. Basically this is a very important topic in pediatrics, okay. So basically how do you define short stature? Let's look at this. Height. So stature means height, right? First of all, what are you talking about? Height. Height is less, correct? Height below third centile. That is third, how do you write third? Third. Height below third centile, right? Or more, it is 2 standard deviations below the median height for that age and gender, okay. Less than 2 standard deviations. How much? Less than 2 standard deviation. Very important for you to write this definition exam. Less than 2 standard deviation, okay. So how will you know this then? So you should have the growth chart like this, okay. And here on top they have put length. At the bottom they have left space for weight, okay. See, one graph is actually length and one graph is, see, this is length and this is weight, okay. In this, what are we concerned about? Length, okay. So we'll go with length. Why are they calling us length and not height? Because in children, we sometimes don't measure it vertically, right? They make them sleep on the, sleep and they'll measure, what is that called as? Infantometer, right? How they make it sleep. That's why they're calling it as length, okay. So you will go to this chart and you will plot it and then you will see whether it is less than 2 standard deviations or not. So how will you know it is less than 2 standard deviations or not? See, they have written here. Okay, hold on. This thing here, 5, 10, 25, 50, 75, 90, 95. The middle line is actually 50 percentile, okay, 50th percentile. This one, the exact middle line, which is a little bold than the others, right? This one is the 50th percentile, okay. Whatever they are shown here is the outer one is the 5th percentile. If it is below this, it will become, you can say it's 3rd percentile, okay. So this will be 3rd percentile or less than 2 standard deviation. Then it will be short stature. See, actually, then how do you know whether it is 2 standard deviation or 3rd standard deviation, okay. So if it is, let us use this color. If it is here somewhere, it will be 2nd standard deviation, okay. This will be 2nd standard deviation. Below, it will be 2 standard deviation and below that will be 3rd standard deviation. Okay, you'll have to calculate this. This is actually the weight chart. Okay, see, look at this. This green one is normal and below that you have the below 2 standard deviation and the red one is below 3 standard deviation. Okay, guys. So understand, 1 standard deviation, both sides, if they are taking, it is green only. If it is below 2 standard deviation, yellow they have marked, and if it is below 3 standard deviation, they have shown red. This is actually weight chart, okay, not height. Actually, this is the height one. And actually here it is showing birth to 36 months, right? That is 3 years. You will get growth charts for older children, okay? You just have to search it. So guys, understand one thing. Weight is a very good determinant for development and growth actually. Weight is the best one, okay? Because weight will change every day, right? Weight will change. If you eat well, weight will become more. If you eat less, weight will become less. So weight fluctuates a lot and it will give you very quick thing. But what about height? Height tells you things which are long term. So height is telling you long term stuff. It is telling you the build, okay? It's telling you the build. Height will tell you the build. Weight will tell you how well the person is nourished, okay? So what you should understand is weight will have short term fluctuations, etc. But a height of a person tells how well he has been the entire life, okay? So what else? What are we looking at? We're looking at short stature. So we've understood the definition, okay? Now 3% of children can be short, okay? And most of these, if they will be this below 2 standard deviation, that means above 3 standard deviation, these will be familial. Familial means they will not have any problem as such, okay? Their genes are like that. So the genetic potential is like that. So you can ignore that, okay? You can just measure the parents' height, etc. So you know that mid-parent height, right? We have already discussed this mid-parental height and all. You can check and you can see what the potential is. And basically the velocity at which the person is growing is still fine. Look at this. They have told you this familial. Familial means how that person will be. See, the velocity is normal. The growth velocity is normal. The height is short, but okay, the family itself is short. The bone age is normal. Puberty is normal. Okay, so everything is normal. Now, the other thing they told you, if it is 2 to 3 standard deviation, the other thing that is possible is constitutional growth delay. What is this? This, you see, final height is normal. So, there is no problem here. Final height is normal. Then where is the delay? There is currently delay. Currently, the height is less. Okay. There is delayed puberty. That also we don't like. But the velocity at which the person is growing is fine. Finally, he will reach the correct height. So, this is constitutional growth delay. A very, very interesting thing, right? Constitutional growth delay. These growth decelerates, okay, for some time. Then again, the velocity is resumed and they continue to grow. Okay. So, basically, you should just check that there is a proper velocity of growth. Finally, they will reach the exact height that they have to reach. They will not be short. Understand this. Finally, the height will be perfect. Okay. But in familial short stature, they will not reach that height. But that is not a problem because that is their growth potential. Their velocity is normal. Velocity is normal in both of these. This is physiological short stature. Okay. So, where were we? If it is 2 to 3 If it is 2 to 3 standard deviation, it can be familial or constitutional. Constitutional will anyways make it up in life at the end. So, these are like some tortoises which finally make up at the end. Familial means they will grow only to this much. So, but their height, velocity is fine. Okay. Now, let us come to the red one here. If the stature is below 3 standard deviation, then it is considered as suffering from pathological short stature. This is what we have to focus on in this video, isn't it? So, let us go to pathological. Pathological means main things that the textbook wants you to learn is undernutrition, chronic systemic illness. They have some illness, not getting enough nutrition. Chronic systemic illness, not at all nice to hear. Growth hormone deficiency, insensitivity. The growth hormone is not putting any effect on them. Hypothyroidism, very important because hypothyroidism not just affects growth, it can affect the brain, right? A lot of things. So, these are the main 4 you have to remember. Apart from this, what and all will you write? Cerebral palsy, that is an insult, right, to the brain. Then congenital heart disease is there. Cystic fibrosis, asthma. These people are not just able to grow with all these morbidities, right? Malabsorption, celiac disease, chronic liver disease. Just blame everything in the body. Autoimmune problem. Some chronic infection. Endocrine process means hypothyroidism, right? What else? Cushing syndrome is there. Cushing syndrome, they'll have short stature, is it? Because this is little different for me, okay, to know. Pseudo hypoparathyroidism. What is pseudo hypoparathyroidism? This is like parathyroid hormone is there, but the body is not responding to it. The body fails to respond to parathyroid hormone, okay. Then let's continue. Precocious or delayed puberty. Precocious means early, right, and delayed puberty. Either of this can happen and that can lead to short stature. Psychosocial dwarfism means what? Because psychosocial means baby is not getting enough attention, the people are ignoring it, some kind of a behavioral thought kind of a dwarfism looks like, right? More like, you can say emotional deprivation. That will be a better word for us. Emotional deprivation, right? Then children born small for gestational age. This one you should very importantly, when you're taking history itself, you should know the birth weight, birth length of the child, right? That will tell you they were born small, right? But they're growing at a normal velocity, let's hope. Skeletal dysplasia, achondroplasia, rickets. Rickets can be basically due to vitamin D deficiency, etc. Genetic syndromes like Turner syndrome, Down syndrome. Okay, so please write almost everything that you hear in pediatrics. If you write in this table, it will be correct only almost, right? So the child is not growing enough, right? These are all the pathological causes of short stature, guys. Now let us look at this. If a person has low, by history you can check, okay, the person has low birth weight, okay, then what? Well, it was born, weight is less, okay, weight is less, but we are talking about height here, small for gestational age. If the person has polyuria, he is urinating a lot. Chronic renal failure, renal tubular acidosis. See, polyuria also can be renal failure, oliguria also can be renal failure, what? Okay. Chronic diarrhea, greasy stools he has. Malabsorption. Greasy stools kind of indicates to me like obstructive jaundice or something, is it? No bile. But anyways, there is some problem with the absorption, okay? Neonatal hypoglycemia is there. Or jaundice, micropenis, hypopituitarism. Pituitary is not developed enough. If the baby has a headache, vomiting, visual problem, some pituitary space occupying lesion, craniopharyngioma, lethargy, constipation and weight gain, hypothyroidism, very good. Then, if the baby has inadequate dietary intake, guys focus here, inadequate dietary intake, it's not eating enough, undernutrition, but it should be, please eat more, okay, you should tell the baby, you're already not eating. Social history, social dwarfism, we told you, emotional deprivation. There's a delayed puberty in the parents itself, constitutional delay of growth and puberty, but later in life, these people will catch up, they are saying. Okay. So these are about history. Then there's one more here. If by examination you can find out, okay, there is disproportion. There is disproportion. The baby is not proportionate. Then it can be rickets, hypothyroidism, skeletal dysplasia. If there is dysmorphism, then there is some congenital syndrome. What do you mean by dysmorphism? Doesn't appear symmetric or something? So that will be some congenital syndrome. As soon as you see, you will see probably there is some congenital syndrome. Pallor, if the pallor is there, that means anemia. That means that baby has anemia. Hypertension, if it has. Now the baby has hypertension, chronic renal failure. Frontal bossing, depressed, nasal bridge, crowded teeth, small penis. Come on, think. Hypopituitarism, okay. See, it is having the small penis, okay. You can guess something is less, okay. Goiter, hypothyroidism. Central obesity striae. That will be Cushing syndrome, right? Striae. So there is the umbilicus here and there is some striae, Cushing syndrome. So are you seeing any such features in the child in front of you? Are you seeing hypertension? Then check for renal failure, could be a cause for the short stature, okay? Then how will you assess the child? You will accurately measure the height. Then you will assess the height velocity. So for that height velocity, you should keep on plotting this chart. Otherwise, how can you know the velocity, isn't it? So you should know at least some values to plot and find out if it is going up and at what speed. So the speed also should be proper, right? Then only it can make up. If it has to make up here and currently it's here, then the velocity that you want it to be should be somewhere like this, right? You should know. It should start picking up at this rate. Basically, you should know the velocity. Assess a comparison with population norms. So that's how will you compare with the population norms? You should have the growth chart. Comparison with the child's own genetic potential. Yeah, check the parents' height, etc. Assessment of body proportion. The body should be proportionate. Sexual maturity rating. This will be more like at puberty, right? Yeah, this is more like at puberty, guys. So these are the assessment, okay? How will you assess? What and all will you assess? Exact height, velocity, population norms, child's own genetic potential, body proportion, sexual maturity rating. Okay, how will you do? Level 1 investigation. You will do complete hemogram with ESR. That is, you will do check the hemoglobin to check for anemia. You will check for the WBC, RBC, platelets. What else you will check for? Bone age. So you should do X-ray, right, of the wrist joint or something. You can come check the bone age because the bone will give you the very good age, it will tell you. Then urine analysis you should do. For microscopy, osmolarity, pH, you can find out if the kidney is working fine. Urine analysis can indicate to you what and all it can indicate to you. If the person has glucose in the urine, proteinuria, any nephrotic syndrome, nephritic syndrome. But growth-wise, what can you know? pH, osmolarity, microscopy for organisms. Okay, fine. Stool examination you should do for parasites because parasites can be causing short stature. It's an infestation, right? Steatorrhea means basically that bile is blocked, obstructed, could be. Right? Occult blood. Occult blood means there is blood in the stool. Okay, you should check for that. Check for blood urea creatinine because this will indicate to you the kidney function, right? How well is the kidney working? Urea creatinine. Bicarbonate pH basically again to know whether the person is having some acidosis like that. Calcium phosphate, alkaline phosphate, basically you want to know if these people are losing in the blood, enough calcium is there or not, if phosphate is there or not, alkaline phosphate, from where is it coming? If it is coming and it is in excess, can it be some bone issue? Fasting glucose you should know, because if the person has high glucose, then it can be diabetes. If he has low fasting glucose, it can be hypoglycemia, insulinoma, etc. Then albumin, transaminases. Why will you check for albumin? Because if the person has albumin is less in the blood, can be that it is actually getting lost in the urine. Transaminases and all you will check. This is nothing but ALT, AST, right? Those are those liver enzymes, okay? Then after the basic checkup, you will do the basic checkup, whatever they're telling, blood checkup, urine checkup, stool examination, bone age, okay? Then coming to level 2 investigations. Level 2 investigations, okay, I just wanted to say something here. You know, has anybody done stool examination? Because I have not seen stool examination. They will directly, prescribe an albendazole, mebendazole. But checking for blood would be a good idea, right? And the color of the stool, etc., you can ask the mother. Okay guys, now let us move to level 2 investigations for short stature, okay? What other investigations you can do? Check for thyroid, right? Thyroxine, thyroid stimulating hormone. Check for karyotyping in girls. Check whether this person has Turner syndrome or Down syndrome. Level 3. Here they didn't write down, but anyways, we said it. Level 3 investigations, what you can do? Serology, celiac serology means what? Anti-endomysial, anti-tissue transglutaminase antibodies. So you will check for some antibodies. What is celiac actually here? See, celiac actually refers to abdomen, they are saying. So what is endomysial? Endomysial means what? So this is gluten. Antibodies to the gluten. Okay. Okay, then coming to anti-tissue transglutaminase antibodies, you have to check. Okay, provocative growth hormone testing. So you will give something and check how it is processing it, right? The body. Serum insulin-like growth factor binding protein 3 levels. So you'll check insulin-like growth factor. MRI of the brain you will do to check for the pituitary and the hypothalamus. So if you are having some pituitary adenoma or some pituitary problem, they can check, okay? If there is low peak growth hormone levels, okay? So what did you understand here? What assessment will you do for a child which seems to have short stature? You can do blood checkup, urine, stool, bone age, etc. Then you can check thyroid levels. Then you can check pituitary hormone levels. Then karyotyping you can do, celiac serology, provocative growth hormone test, insulin like growth factor, MRI of the brain, etc. you can do, okay? So this is all about short stature, guys, from the textbook. Basically, in the previous video, we have looked at how to calculate the child's height, and the formula very simple. Height is equal to 6y plus 77. Y is what? The age in years, okay? We'll remember like that. 6y plus 77. So if the child is 7 years, put 7 here. 6 7s are 42 plus 77, 119. So that is the formula. You have to remember this formula. Only one formula to remember for height. 6y plus 77, okay? That's it, guys. In this video, you have understood short stature, isn't it? Definition: height below 3rd centile or below 2 standard deviation. Okay. Then short stature. If it is 2 to 3 standard deviation, it can be familial or constitutional. If it is more than 3 standard deviation, they could be having pathological short stature. So pathological short stature usually will be because of undernutrition, chronic illness, growth hormone deficiency or insensitivity, hypothyroidism, and a lot of other causes. Based on history, how to guess the cause, and based on examination, how to guess the cause. How will you assess a short stature child, and what investigations you will order. And based on your report, you will have to treat the cause, isn't it? Height of a child approximately you can calculate as 6y plus 77. This is the height that it should be. Okay. Expected height. 6y plus 77. Okay. That's all for now in this video on short stature. Bye bye.